So what is supportive oncology care? Well, basically, it's cancer care that is coordinated through a contribution of a collective group of medical and non-medical specialists. They're really trying to help prevent and manage the adverse effects of cancer and its treatment. This includes both the physical and the psychological symptoms and the side effects, but it's across the whole continuum. So literally from cancer diagnosis, through anti-cancer treatment, through to post-treatment care. And it really is about making excellent cancer care possible. So this just gives you a bit of an overview really of how it sits. So it's like this overarching umbrella really, which just encompasses everything, which really when you think about it is what should be happening anyway. But it's about making sure that the patient has access to every single element of this throughout their cancer journey. In the past, supportive care very much used to be focused around palliative care. And what we're knowing now is that it shouldn't be just that you suddenly get a palliative diagnosis, there's no further treatment, and then you move into that supportive care arena. This is going to be a continuum, so you've got access to the same people, same professionals, same services throughout the whole personalised care and support self-management journey, really. It involves everybody. Okay, so this is where we sit as part of trying to do the side effect management. We've been quite good, I think, at setting up prehab services now, so prehabilitation, particularly for patients that are having surgery. You tend to find that we try and get patients in an absolute optimum condition, the best health that they can be at that point, and prepare them. And the idea then is then they have shorter inpatient stays. And we also know that this is also really important for rehabilitation afterwards, but that doesn't always happen to date. So it's about having this whole supportive oncology network where we're looking at the financial side of it, there's access to psychologists, is the social works involved, are we getting people back to work, really caring for the whole person, but using who's the best person for that within the clinical team. So the key principles really of this supportive care is that it's a symptom-based approach. It shouldn't be about where you are in your journey, it should be about what you are experiencing, what that symptom is, what that means to you and what matters to you, and then how do we help you to get the best outcome using a holistic approach. So a holistic approach is where we're really trying to look at you as a whole person so that we're addressing everything, so the psychological needs, the physical needs, the spiritual, the financial. We also know it's about early and effective time management with this. We don't want patients to be sat for 2 to 3 years with a symptom that actually we could have helped to deal with, back when they first started to present with this. And it's about personalising that support, like I said, so tailoring it to the patient. Patients are actively involved in this supportive care. Like I said, it's very much about what matters to you, not what we think matters to us as professionals. They're trying to make it as evidence-based as possible, and it really is about this collaborative, multidisciplinary working. So not necessarily about, just because you haven't got a speech and language therapist, say, but who else could maybe access that support and help provide and guide. In terms of management of symptoms, like I said, again, it's this holistic support, and again, making it person-centred, and I'll keep coming back to that because that is what is the key. I know in my service that if I can't get a patient on board and I can't understand what that matters to them, so the dry mouth, if they're not bothered by it, they're not going to want any help with that. But just because they've ticked it on a box that they've got a dry mouth doesn't mean then we should launch in for a 20-minute conversation about a dry mouth if it's not bothering them. They may be living very well with that, but there may be something that they have identified that then we're just not putting that on because we don't feel that that's important enough to be dealing with. But it doesn't just, like I say, focus on the physical symptom, it's how it's affecting your life. So how have you been left, or how is the diagnosis, how is that affecting you as a person? And it's tailoring those individual needs to that person. So in terms of who's involved, it's everybody basically. So it doesn't matter who it is who's giving that intervention. It's about having a pathway, a team of professionals who can help and support. It might be that it's the Maggie centres that are providing the psychological support, but then it might be the clinical psychologist who's in the trust. It really depends on each individual pathways. It is much more on the national agenda now. I know the Christie are quite leading the way actually in supportive care. They're really trying to look at it from that whole. It did start again from the palliative care team. It's not something that we have in Nottingham, But there are some innovative UK centres now that are really trying to provide these clinics, and where they're really trying to start from is like a rapid access clinic that patients will always have access to, regardless of whether you're 2 months out of treatment or 10 years out of treatment. You'll have, and you don't have to be back in that palliative setting to be able to access that support. They're really trying to address these health inequalities via this, so that again we're looking at the whole cancer journey pathway, respective of that stage of disease. And the hope and thought is also that this, if we get better supportive care, then we'll get better diagnosis and earlier diagnosis, because we're picking up on needs, not necessarily waiting for 2 to 3 years down the line for your next scan. You'll know where to be signposted to. In July last year, the Department of Health and Social Care put out their policy paper on major conditions strategy, and cancer, living with and beyond cancer, does sit within this. And the real thing that's really to take away from this is that in 2020 there was 3 million people living with and beyond cancer. By 2040 there'll be over 5 million. So we can see that this is just going to become more and more significant. The problem with it is there's no funding. So we have these amazing papers, but who is going to pay to set up these services? So you'll tend to find that a lot of services are trying to do the best that they can to provide this supportive oncology or supportive care, but they may not have some of the elements. And then just ultimately just to say that really, you know, this supportive care is managing the consequences of treatment, personalised support and empowering the patient.